I'm Mimi Nguyen, and I was in the project in La Ceiba, Honduras, from December 15th to December 29th. And I volunteered at the clinic at La Clínica Atlantida and the hospital Atlantida. Um, so how was our abroaderview coordinator? He was extremely supportive and passionate about his work, and I couldn't think of anyone better to have as our coordinator. And being here, he's treated us like family, and I even call him mi papa, and he calls me mi hija for father and daughter, and so I'm very fortunate to have such a great coordinator. What was the most surprising thing for me? Program-wise, it would have to be how little medical supplies they have here. They would oftentimes run out of supplies, simple things that I would never think of running out in the States, such as gloves or gauze or cotton balls. That was the most surprising thing for me, and even at the hospital too, they would run out. And our coordinator would have to run and go to the store and buy things and quickly run back so we have supplies. Accommodation-wise, what I found most surprising was that they have their water only running, I think, 8 hours a day, from what I believe. And so I would always worry about, maybe if I'm showering, my water will turn off, or I would always be unsure if the water will be on in my bathroom. About the country, what I found most surprising was probably how much trash there is around here. People would litter a lot, but even though there is a lot of trash around here, the country is extremely beautiful, and everywhere you go you can see mountains, and it's really beautiful here, and so I wasn't expecting all of this. Most difficult to experience. Program-wise, it would definitely be not being able to provide the proper care because of the lack of medical supplies they have here. So that was definitely heart-wrenching for me. Accommodation-wise would be cold showers. I'm just kidding. I think most difficult would have to be these past 2 days, just saying goodbye to everyone, and I guess you don't expect to make a family and have everyone feel like family. People here have just been so welcoming, and that's definitely been the hardest part for me, is just saying goodbye to everyone that means a lot to you and made you feel like family and welcomed you so much. Most difficult about the country is not being able to speak Spanish. That has definitely been a big challenge these past 2 weeks, and but although I don't speak Spanish very well, being here has definitely made me want to learn Spanish more, and encourage me to ask questions, like "Cómo se dice this or that?" and so I've definitely learned some new words, and I'm excited to go back in the States and hopefully talk to some of my patients in Spanish with some of the words I picked up here. Some tips for future volunteers, clothing-wise, would be to bring tanks, shorts, nice clothing for special occasions, sandals, towels, scrubs, long sleeve pants and shirts just in case there's some cold nights, and a raincoat. Some tips for donations that they would appreciate would definitely be gloves, cotton balls, gauze, maybe over-the-counter drugs like ibuprofen, alcohol wipes, and hand sanitizer. The weather here definitely varies. Most of the time it's sunny, but occasionally it would just start pouring rain, and there would be just nonstop rain for maybe 10 minutes. I remember I was walking outside one day and just all of a sudden started pouring rain. So that's why I said bring a raincoat just in case. Some other things volunteers should know is to definitely bring bug spray and maybe something to help the itching. I brought this little tube, it's called Afterbite. That kind of helped. Possibly, oh, you should definitely look up the different kinds of diseases they have here just to be cautious. Bring a first aid kit when you go somewhere, because this one time we went on a hike and I got attacked by bees, and I didn't know if I was allergic to bees then, so it would have been really bad if I was. So that would have been bad if when we didn't have an EpiPen. So, you know, always want to be prepared. Other advice is do not pull out your phones in certain areas, because that's something I did, and the doctors got mad at me because some of the places are really dangerous and they could rob you and hurt you, and so be careful where you have your phone. So my personal paragraph, I would just have to say that leaving here will be very difficult for me, because I just feel like I have such a purpose here in helping the people of La Ceiba, and everyone's just so grateful to have us here and always thank us for, like, thank you for coming to my country and helping me, and like they're just so grateful, and for what little they have here they're also just so happy and grateful for what they do have, and that's something that I'll really miss about this place. How would I describe my accommodation, meals, and security? Accommodation meals were great, as I think you can tell that I love it here, and that they've really made me feel like home here. And security as well is nice. Our house it's fenced off, and so I don't have to worry, and I feel very comfortable staying here. Favorite memory of this trip? Program-wise, I would have to say going to do vaccinations. That was definitely different for me, because we literally went from door to door knocking and asking if they want to get their vaccines, and we would even go out on the streets and help vaccinate people, and so it was definitely different for me and a lot of fun. Country, what was your favorite memory about the country? It would be hiking Pico Bonito, which is also where I got stung by the bees, but I quickly forgot about it when we got to the waterfall at the top, and it was just absolutely beautiful, and you could stand underneath the waterfall, and it was very unreal moment, I'd have to say. So that was my favorite. How was the support about traveling, the abroaderview support? They were great. They were quick to reply to my emails, and there was this one time when I was at the post office and I called them, and they knew exactly who I was because I emailed them like 3 minutes before, and then because I was just impatient about asking them questions. So they're really on top of it, and answering questions, as well as the website was really informative of all the things you need to do to help you prepare for your trip. Am I willing to speak to other potential abroaderviews? Yes, of course. I would love to share my experience with you guys, and hopefully encourage you to come here. It's been really great, so I would love to talk to you guys, and I hope that you enjoy La Ceiba as much as I do.
Thank you, Mimi, for volunteering with abroaderview Honduras. Have a safe trip home, and we hope to see you back very soon.